Welcome to the Neurostimulation Podcast. I'm Michael Passmore, Clinical Associate Professor in the Department of Psychiatry at the University of British Columbia in Vancouver, Canada. The Neurostimulation Podcast is all about exploring the world of neuroscience and clinical neurostimulation, how it works, the latest research breakthroughs, and how that research is being translated into real-world treatments that can improve health and well-being. This podcast is separate from my clinical and academic roles and is part of my personal effort to bring neuroscience education to the general public. Accordingly, I'd like to emphasize that the information shared in this podcast is intended for educational purposes only and is not medical advice or a substitute for professional medical guidance. This episode is presented by ZipStim Neurostimulation. ZipStim is the neurostimulation clinic that I own and operate. You can find out more about our clinical neurostimulation programs at zipstim.com. That's ZIPSTIM.com. Today, I'm really looking forward to a discussion with Dr. Evelyn Higgins. Dr. Higgins is the founder of Wired for Addiction and Wired Biohealth. She is an addiction medicine specialist and has written a book called The Mystery of Happiness. Dr. Higgins' work integrates the science of addiction recovery with the latest research on mental health biomarkers and epigenetics to offer a comprehensive approach to personalized health and wellness. Some of the things we talked about today include mental health and addiction recovery strategies, biohacking, biotech, and wellness strategies, as well as strategies to optimize holistic wellness and personal growth. We discussed aspects from the broad strokes of spirituality and psychological well-being with real-world strategies that you can implement to improve your own health and wellness. And we also focused in on the fine-grained aspects of epigenetics and biochemistry as it relates to improvement in health, particularly in terms of addictions and mental health concerns. We had a really interesting discussion, and I'm really excited to share that with you. So stay tuned. Dr. Higgins, thanks so much for joining us today on the podcast.
It's my pleasure, Dr. Passmore.
Dr. Higgins, you've had such a diverse career, from advising the U.S. Surgeon General to serving as an Olympic team doctor. I'm curious what led you to focus on addiction recovery and mental health biomarkers?
Great question. Really both personal as well as professional. Personally, I was in practice some 38 years and in a rural area initially, and wasn't seeing many tools to use in the area of addiction and mental health, really, and saw people becoming somewhat dependent on treatment of pharmaceuticals that were kind of haphazard, really, at that time. And then 20 years after that, I was in an urban area practicing and thinking maybe there'll be more tools available in this area, be more progressive, and that's not what I found. It was still the same really antiquated way of dealing with this problem. And then personally, I married a man who was an alcoholic and really had several addictions. We had a child together, and a year after our daughter was born, found out that he was adopted. And I'm seeing these behaviors in him and having absolutely no family history whatsoever. Fast forward to where science starts to evolve, and neuroscience becomes a more commonplace word than it was, some almost 40 years ago, 38 years ago. And even from neurotransmitters, things like serotonin, dopamine became more commonplace in people's understanding, really, because there are so many SSRI drugs out on the market. Serotonin was a word that people understood. So as the human genome was mapped out, 2003, right? Then 2008, we're looking at the 1,000 most significant genes for clinical purposes, for disease purposes, and things continue to evolve. Then we were able to look at the SNPs, right? Or the polymorphisms, the variants. that exist within the genes. So all of this science took me along the way because I was looking at an area of healthcare that really wasn't being treated like healthcare.
Mm.
There was still a stigma attached, and there still is today. Kind of the mentality of you got yourself there, you can get yourself out, and we weren't using technology in the way we were in other aspects of healthcare. So it really drove me to where we are today.
Mm-hmm. Yeah, no, that's really interesting. Yeah, it's fascinating. I encounter this a lot in my work, and I think it leads to a lot of frustration on the provider side as well as the client side, right?
Right.
Because, the tools that are kind of advertised as available and helpful, there's so many people who just don't get the response that you're hoping for with medication and,
Right.
even combination medication and psychotherapy. And I think that's part of what is interesting is in exploring other kinds of therapeutic options for people,
Right.
particularly when it comes to something complicated like addictions, really.
Exactly. Complicated is the word because there's so many layers to addiction, right? The physiological aspect, and then there's the psychosocial. So it's really a biopsychosocial disease. And everybody comes into it with different nuances that we've got to uncover these layers. It's not, and we're looking for a single molecule solution to something that's not a single molecule problem.
Yeah.
Right. And one of the things that I say over and over again is we have 8 billion people in the world with 8 billion different sets of DNA, yet we're treating everyone exactly the same. And then, saying, wow, how come we didn't get the results that we were after? No two people are made up exactly the same. So we've got to take all those nuances into account into the individual. And unfortunately, the system really just isn't set up to take that much time to look into all the different aspects of what make up an individual, and then what were your life experiences, because epigenetically that's going to change someone.
Yeah, for sure. 100%. No, and that's really, I think, a key issue, as you say, call it the system. I understand entirely what you're referring to there. It's everything from kind of the pharmaco-industrial complex where, there's a lot of capture within that kind of system in terms of the provider kind of being, informed by research that's funded by drug companies, and
Right.
that reductionist kind of model where you have the neurotransmitter, you have the interesting science behind how these medications alter neurotransmitter function, and that correlates with clinical outcomes in the studies, but often that doesn't translate well into the individual person that you're trying
Right.
to help, right? So
Right.
it is really exciting that this, the promise of the personal genomics in terms of targeted medication and what have you, but that's still only a small piece of the picture. I think
Right.
as you say, it ignores the nuances that every individual person brings to the table,
Right.
So, and it kind of leads me to another question that I had that relates to, as you described, the biopsychosocial
Sure.
spiritual model. I
Sure.
mean, for sure, in Western, as in Western medical training, the spiritual side of it is almost kind of like a tag on that isn't
Yep.
really, it's almost kind of like a dirty word in some
Right.
sense in our kind of hyper secular kind of society. You're not really supposed to talk too much about the spiritual aspects, but in your work in the book, and what you're the kind of system that you've developed to hopefully get out of the constraints of the big system that doesn't serve people well. Your work integrates those 4 pillars: the
Right.
physical, emotional, intellectual, and spiritual. So
Right.
I'm curious how you develop that framework, and why you think that all 4 are essential for well-being.
Sure. And great point that you raise here, Doc, because it's, the way all of this, the big umbrella over it is, to me, I say we're not healthy one day and sick the next. It's all the living that we do in between that brings us to either end of that spectrum, right? And just because we don't have a disease doesn't mean we're healthy. So what are all these different parts of our health, the physical health? And I start there because I'm like, actually, that's the easiest. If someone wants to follow, right, what needs to be done, because it's methodical. Ba-doom,
Yeah.
ba-doom, ba-doom, right? We've got to do this to change this aspect of your physiology. We've got to do the lifestyle things, all those, but they're plug and play. If you want to play along, you're going to be healthier. You have to have your physical health optimized to have emotional health. Mentally, if you don't have that physiology in place, you're going to be struggling.
Mm,
And an addiction, I'll use the term white knuckling, right? You may be sober, but you're not healthy,
mm,
right? So that emotional piece comes after the physical piece. Then after that, it's the intellectual piece. And I don't mean, I'm not talking about an IQ or an SAT score or something like that, but your intellectual health, your creativity, your ability to be part of the world and see the world. And then the last of it, and to me, the most fascinating, is the spiritual part. But we have to have all those others optimized to get to that place. And a lot of people never even land any place close to that.
mhm.
Right. So it's all of those aspects. And it's really understanding that we're not healthy here and sick here. Every day we have the opportunity to go to either side of that scale. And it
Mhm.
really incorporates all those different parts of us and our health.
Yeah.
To me, health is life and life is health. Those are
Mm.
synonymous.
Yeah, yeah, yeah. Absolutely. Yeah, no, that's super interesting. I mean, I think part of the challenge with addictions is that it strikes me that there's this issue around truth, and I think part of what strikes me as an important factor, because especially in terms of the I totally get what you're saying around the requirement for there to be that structured hierarchy in terms of how you're approaching health, right? But the truth piece for me in addictions that complicates it is in terms of the emotional, intellectual, and spiritual
Right.
lining up, because I think a lot of people, I think in a way one of the reasons why addictions are so insidious and can be so refractory to different kinds of treatments is that it's almost as if the person who's struggling with the addiction is fragmented inside, and they struggle with themselves and with others in terms of, well, what is my emotional truth, what is
Right.
my intellectual truth, and what is my spiritual truth? And that the research that shows that programs like AA or NA that addresses the spiritual,
Right.
really that once you get to that point and people can identify that truth and kind of you know clear away all of the fog that the other false selves, I suppose, were, in a self-destructive kind of way, sabotaging their efforts to remain sober. When they find that North Star and kind of identify that as a truth, then perhaps all of those other things can more easily fall into place.
Right. Absolutely. Great way to say it. And I think even like the bigger parts of life, for example, purpose, that fits into that spiritual health, right?
Mm,
And if you were, that becomes this like elusive question to a lot of people of, well, what is your purpose?
right.
It's not the check box. It's not got up today and went to work. That's something that you did. What's your purpose is different than that.
Yeah.
It-
Yeah, it's really interesting. I mean, and I think that's part of what, from an interpersonal perspective, it really makes addiction challenging. And so I appreciated that you're sharing some personal experience with that. And I think it reminds me of a time when I had a family member who was struggling with an alcohol addiction, and this family member came down one time and sat with me and my wife, and he was talking to us, and then shortly thereafter that, and it was a fairly important conversation, we were doing our best to help him out at that point.
Sure.
And I think the next day or the following day, it dawned on me that like everything, well, most of what he was saying was a complete lie, a complete fabrication. And part of what my reaction was real anger. It was like fury, like we're trying to help you,
Right.
and you sit in front of us and you bold-faced lie to us about a lot of this stuff. And I know that that's the addiction. That's how it causes this sort of suffering and dysfunction for people. But to have had that personal experience was a really eye-opening experience in terms of how those problems, cause trouble with the addiction and perpetuate it and make it difficult for people to get into treatment in the first place.
Right. That you raise a really great point there, because when you're talking to someone who remains sober or still is sober that day, you're having a different conversation, because it's all with accountability from that individual and truth from that individual. Whether it's the truth you want to hear or not, it is their truth and how they're living their life. And you really know someone that is still sticking to that part of their sobriety versus someone who's back to the storytelling.
Yeah. Yeah, for sure. No, 100%. I was curious to know, so your book, The Mystery of Happiness, what would be perhaps a key insight that relates to this, or, another
Sure.
important notion from that book? Yeah.
So what I talk about in The Mystery of Happiness is gratitude. And
Mm,
it's something that each one of us can work on in building that spiritual muscle, really, of
mm,
gratitude, doing that every day. And I'll say to somebody, it doesn't have to take a lot of time, 2, 3, 5 minutes tops, write down 5 things you're grateful for today. And what that does is changes your perception of yourself in the world and your vision of yourself in the world. And
mm,
you start redirecting everything that you put into your head into a different way. And it is a great tool. I mean, even myself, sometimes when I get derailed and I stop doing my journal, I'll say, gosh, life has just felt a little bit harder lately. Like, what's going
mhm,
on? Like, when's the last time you did your gratitude journal, right? I'll
mm.
get back on track, start doing it, and then I'm there again. And we're all human, right? We all fall off the bandwagon every once in a while, but you get back on there like, wow, you're really programming your mindset, what's important to you, what you want to focus on, and you're going to get that same thing back from life. When I first wrote that book, it was interesting. A patient said to me after it came out, said, I got your book and I read it last night. And I said, Mrs. So-and-so, it's not a reading book. It's a doing book. I want you every day to be doing it.
Mm,
It's not just the intellectual knowing the words. It's actually putting it into action, right? That's what's going to change your life.
right. Yeah. I mean, it's super interesting because the gratitude piece, it's almost a cliche, but really, I think it's very powerful.
Very.
I can think of a time when I was going through a really difficult personal time, and I just found that there was not really any other option than to try to start journaling about the tiny little things that everyone typically takes for granted, but that if you can direct some intentional gratitude towards that,
Yeah.
and in so many ways, in North American societies, there's so much that we take for granted that we should really be very grateful for. And in just focusing in on that, it didn't seem so overwhelming, right? And so I think if
Right.
people can
Right.
understand that, it just shifts their focus, and that can be a very helpful thing to get through difficult times.
Sure. And, in everyone's life, we have things that, wow, that was a tough time. I can't believe that. How did I get through that? After you're on the other side of it, typically it's like you built more resiliency. You built more resiliency muscle, and you're like, wow, okay,
Hmm.
I can do hard things. I can get through this. While you're in it, you may not want that, but after the fact, so to be able to see all these things, and to equate that with the addiction kind of stuff, there's traumas involved, right? In
Yeah.
everybody's life, whether they be the big T's or the little T's, everybody's got different traumas. It's what they are to you. And so often in a patient that has addiction disease, that the traumas are stuck,
Mm.
right? And reliving those things every day. That, doesn't say, gosh, I want that to happen again. But the fact that we can get past it and process that and accept and acknowledge it
Yeah.
and try to move on to it. These are all the different layers, right? These are all the things that have to be worked on. We meet people in our lives that raise us up. We meet people in our lives that tear us down. In the end, we're grateful for both of them. But at the time, you'd say, I could do without the people trying to tear me down.
Yeah.
But you get past that and you're like, I've got this. Bring it on.
Yeah, for sure. Well, even in that situation that I was referring to, where the family member with addiction was lying to us, at the end of how I kind of processed that when I was debriefing with myself and my wife, is it came down to trying to find compassion and understanding that at the base of that dishonesty is trauma, you
Right.
know?
Right.
And
Exactly.
so then, that was very helpful in terms of working through that relationship with that family member for sure.
Hmm. And may I ask how things wound up with that family member?
Yeah, I mean, I think there's still some distance, but at least, I think we had to put up healthy boundaries, as, you often do have to with people
Yep.
who are struggling with addictions. But in a sense, that's necessary. I think probably at an unconscious level, people need, or perhaps, part of what ends up causing people hopefully to turn in a healthy direction is is when, I guess rock bottom, and they feel like, they're not able to manipulate people, or it's called the addiction isn't able to manipulate people anymore. And then hopefully that there can be some turnaround. But no, I mean, I think that person's, getting help and is,
Right.
on the road to recovery. So I'm very happy to say that for sure.
Right. And I'm sure that conversation was a big part of like, whoa, okay,
Yeah,
I've got to keep
absolutely.
on this.
Hopefully, yeah. I mean, it's one of those things, right? I mean, the growth comes out of the tough times and the challenges and the suffering, right? So
Absolutely. It's never the easy times where we grow. That's not how it works.
totally, yeah.
And, I always say when you meet someone you just know they're different. There's so much resiliency in that person. There's just so much life in that person. There's a story behind that. That's all earned.
Mm-hmm. Yeah, for sure. Character, right? Definitely.
Yep,
And
absolutely.
wisdom, dare I say wisdom, right? I mean,
Wisdom,
yeah,
wisdom, the key.
for sure.
Yep.
Well, it's super. I mean, it's obviously this is critical content in terms of the psychological and the spiritual aspects of addiction. Um, but when it comes down to it, often addiction is seen as a behavioral issue, whether it's, lying or just, being unable to break that habit,
Right.
the physical consumption of the whatever you're addicted to. And so from a physical and biological perspective, I was really impressed that your work integrates things like the biomarkers and epigenetics.
Yep.
So I'm curious to hear from you how these kinds of more sort of specific biological perspectives are important, and how maybe they would change the way that we understand and treat addictions.
Sure. So that's our starting point, because everyone has a unique physiology, and we want to see what your starting point is, so we know, what we have to work with. But when you look at those biomarkers, they are so there's never a shock, shall I say, right? We're looking at these biomarkers, and especially the neuropsych part of them, the GAD1 gene, just, that the glutamic acid decarboxylase 1. So what's the job of that gene? To convert glutamic acid, a stimulant neurotransmitter, to GABA, a calming neurotransmitter. If your body can't convert, you never feel that calm. You're always in the state of anxiety. Think about when we have an addiction, what are we doing? We are reaching outside of ourselves to self-medicate, not even knowing that's what we're doing, but we're like, whoa, when I do this, I feel so much better, right? So that's just one example, but looking at those neuropsych genes, that gives us a starting point of like, wow, not shocked, and then we look at different areas. But when we go over the results with people, a lot of times there's tears of joy, saying like, wow, this is exactly how I feel. I can't even explain this to people. Or people think I'm trying to act out this way, or I'm trying to do this, or I'm trying to do that. Like, feel completely validated as to how you come into the game of life. Everybody's wired, right? Everybody's got their own unique DNA. So this is how you come into the game of life. All right, we need to know that as our physiological starting point. Then we still have to do all the other work in the psychosocial. You can't leave that out. That's, that's another really big part of the puzzle. But in knowing what you're beginning, so much benefit could happen, because if we optimize what we have to work with, then the other parts of what you're doing in your talk therapy, whatever it might be, you're going to be able to absorb a lot more of that for a better end result.
Right. Yeah, it's the foundation. It's starting with the foundation. It's really impressive, being able to, again, get to the approach of personalized medicine and,
Right.
Taking advantage of understanding more about an individual client's genome and targeting therapeutics appropriately.
Exactly.
It's interesting. And I imagine that, it strikes me that in the United States, there's likely to be more. Part of what I think is frustrating sometimes for Canadian practitioners is that our system is a little limited in terms of those kinds of options for people, just having those constraints of a public health system. For instance, I read Peter Attia's book Outlive a couple of years ago, and I was thinking, it would be really important to try and follow some of his recommendations and get some of these tests. And so I went to my own family doctor and I said, hey, can I get this, that, and the other test? And he kind of looked at me as if I had two heads, and I, so basically it's not available, even though I'm curious to get it, and I, can't pay for it really unless I go down to Washington State somewhere. But when I didn't go that far, but it just shows that often, those are the checks and balances with a publicly funded healthcare system where, maybe the individualized, personalized medicine isn't so available. So
Right.
yeah, it sounds like that's a really great foundation for you and your clients to be starting off on.
Absolutely. And we've had people come to see us from other places in the world, as far as Australia, because this is what I need. I've tried everything already. Like, we're typically not the first stop, right? Everybody's going to just try the simple fix. Again, back to looking for a single molecule solution to a problem that's not a single molecule problem. But we're so ingrained into it's that easy that's where people will start. Yeah. And then knowing, though, as you say, with personalized medicine, there's so much more available of how we can analyze you and your blueprint.
Yeah.
And then how do we optimize that blueprint for you? Everybody's
Right.
dealt their own cards. Here's your DNA, play it out. To me, the most fascinating part of science is epigenetics, because that gives the power back to the individual. Knowing that your environment, your stressors, your circumstances can turn off, turn on, your genes, that gives the power back to the individual.
Right. Yeah. Maybe do you mind just defining epigenetics for viewers and listeners?
Sure. So epigenetics, so your DNA, your cards, right? These are your cards. This is your DNA, play them out. The DNA structure itself doesn't change. Epigenetics changes the expression of that DNA.
Right.
So the histones, not to get too much science into there, but the histones are the place where the action happens. So example, patient that we had 20 years, child was 21. The young woman was 21. The mom says, I have never seen this behavior in my daughter ever before. Okay, what happened over the last year? 20 years, never behaved this way. Comes back from college, I'm seeing a different kid. Okay, so the last year she went away for the first time. Yes. I'm like, okay, so let's take a look at everything. This was always there in her DNA, but we never saw it show up. It was never expressed that way because she didn't have the same stressors. She's now trying to do her school. She's trying to hold down a part-time job. She's not eating the same as she did when she was home. She was definitely not sleeping because she was having fun all the time when she wasn't doing school. All right, the college experience for kids. Yeah. And she had all new friends. So her total environment had changed. That changed the expression of her DNA. So these things that were always there that we never saw show up, all of a sudden showed up.
Yeah. That's super interesting. Yeah, it's amazing how the environment can actually influence the genetic expression and vice versa. It's a two-way relationship, isn't it? And it's even more complicated than that, isn't it, when you think about the potential for intergenerational trauma to cause epigenetic changes through the generations, which is completely fascinating.
Yeah, that's a book that I'm writing right now that I'm working on, and it is that intergenerational as part of it. It is so fascinating, and what we continue to learn. And it's, again, back to like what I said to the patient of, it's not a reading book, it's a doing book. It's first understanding, and then, okay, what am I going to do to change this? So often people just take on the exact same habits, behaviors that their family has. And it's kind of this like, okay, my dad died at 50, my mom died at 55. I might as well just play hard because I'm going to be dead somewhere between 50 and 55. No, it doesn't have to play out that way. But you have to first say, I'm willing to learn new things, and then to act accordingly to that, right? To me, the sweet spot of all of it would be someone doing this early in their life, knowing this information. This is kind of the key. This is what's going on with you. You are going to have all these different experiences in your life. I want you to know how you handle that is going to affect you. Whereas your buddies may be able to, hey, after school, we're all going to try this drug. We're going to go and do it. Like, oh, okay, go along. Next day, they're like, oh, we're never doing that again. And you're like, oh, yeah, I want to do that. So having that information available, you still get to make your choices.
Yeah.
But knowing, we all have strengths. We all have weaknesses within our DNA. It's
Yeah.
in knowing what they are and how they could potentially affect you is what matters.
Yeah. Yeah. It would be kind of like, offering a young person a user manual, for themselves.
Exactly. Here it
Yeah.
is. Do
Yeah.
what you want with it. You need to
Sure.
know this. Yeah, it really is. And that can be a huge game changer for people.
Definitely. Yeah. No, for sure. So when you're talking about when patients and clients come to you, is this through Wired Biohealth?
Right. So we started with Wired for Addiction because we were first in the criminal justice space, and we still are. We do a lot of work in that area. But people started coming to us saying, this makes so much sense. I am not quite at the addiction stage of things, but I definitely feel like I'm moving in the wrong direction. Can I go ahead and take a look at everything? So we started Wired Biohealth, which looks at the mental health side of things and addiction side of things, as well as wellness. So for example, when I use the addiction example, and I talked about the GAD1 gene, we're not converting the stimulant to the calming. So the other areas we would look at, for example, are take a look at someone's mitochondria.
Mm.
If someone says, I just feel depressed, don't feel like getting up off the couch, life doesn't have the same zest as it always had, I'm like, okay, potentially that could be depression, diagnosis depression. Is it serotonin? Is it dopamine? Is it epinephrine? Is it norepinephrine? Is it one of those, two of those, three of those, four of those? We don't know, right? Unless we measure. But beyond that, it would be, so let's take a look at your mitochondria. Wow, you've got some serious mitochondrial weakness where we're not creating the energy that we need. That causes a low mood. Or is it all of it? We don't know unless we look. We're throwing a dart, hoping we land someplace close when we're just guessing at the reason behind how you're feeling.
Yeah, no, it totally makes sense. I mean, and it makes sense in terms of what we were talking about before, when, a person might be given a standard treatment like an antidepressant, and sure, a small percentage of people might actually get some improvement, but maybe they're just the ones who all those other things happen to be lined up in the background, and they may not need any of those other alternative approaches, but the ones who don't respond to the antidepressants, what's lacking is, as you say, attention being paid to all of these other important things that are factors in contributing to them feeling depressed and anxious.
Exactly. And one of the genes that we also look at can tell us, would an antidepressant even be effective for you?
Right.
So we see people that have been for decades, like better than 3 decades on an SSRI or an antidepressant. First off, they were never created to be long-term use. They were created for short-term acute care, somehow got into the chronic, and decades they're on these things. Their serotonin is still in the tank, so it never addressed that. But beyond it, take a deeper dive and look at that particular gene, and it was never going to be effective for you to begin with. So you look at all the different layers of what that does to someone. From first off, clinically, they're not doing any better, they're struggling. But emotionally, what does that do to someone? They start being told, no, this works. This is you wanting to be this way.
Yeah.
Emotionally, you've lost hope in everything.
Right. Yeah,
Right.
I know it's almost as, I mean, having been on the prescribing side for 20 odd years now, and it's almost like an expectation. And you say to people, well, if this doesn't work after 2 or 3 months, then we can try something else for 2 or then you do that a few times, and then they're looking at 6 to 12 to 18 months of struggling with different medication trials, and it's no wonder people get frustrated and discouraged.
Exactly. Yep, we'll double this, we'll half it, we'll change it to this, and then you're just still struggling that whole time when it was never going to be effective to begin with. We had to figure out another way to address those biochemical pathways to get optimal results.
Yeah, for sure. Are there, as far as addiction, I mean, I know it's a broad question, but addiction and mental health, are there specific biomarkers that you tend to focus in on, or specific groups or types of biomarkers?
Sure. So all the neuropsych, first off, because there's always a dual diagnosis, right? It's whether it be anxiety, depression, ADD, ADHD, OCD, whatever it is. So we look at all those different neuropsych, from monoamine oxidase A, monoamine oxidase B, GAD1, COMT, all of those genes. And then we look at the different headings under methylation. But, when we talk about methylation, people might say, well, I did the 23andMe and they look at the MTHFR gene and I'm good to go. I'm like, that's one methylation gene. We're looking at 14 different methylation genes for a reason, because they all matter. Because that could be misleading information if someone says, nope, I'm methylating, I'm all good, but actually the other 13 are problematic, right? So we look at all those in methylation, we look at mitochondria, we look at inflammatory markers, a lot of inflammatory markers, because they're going to exacerbate any kind of neuropsych situation that the individual has. We look at vitamin D, because it's so important to so many biological processes. We look at something called autophagy. We've known about autophagy for like 100 years, but it was 2015, that the Japanese physician won the Nobel Prize for understanding the intercellular relationship of autophagy. Autophagy is kind of like the garbage man of your cells. Right. So you think about the analogy I use is, if you went on vacation and forgot to take the garbage out, you came back a week later, your place is going to stink. And it could affect your carpeting, could affect your furniture, even your clothes, depending how close it was. That's the same thing that's happening with your cells. If you don't have a way to get rid of the cells that naturally die off every day, and they're supposed to, right? If you don't have a way to get rid of that, all that garbage is piling up. It's then going to affect all the other cells around it. Same with detoxification, a process of our body that should happen naturally every day. But if we're not detoxifying, we're literally going to become toxic. It's going to affect all the other cells. So we look at all these different categories, put all of that information together, because they all matter. All of the, again, back to, it's not one thing. It's everything collectively together. And then the complication of addictions is looking at all that, starting point for your unique physiology, okay, is then the other layers that we've just been talking about, that psychosocial piece. What happened to you? Tell me about your life, and where those points of being stuck are.
Right, yeah. No, the autophagy piece is really interesting. I think, isn't that one of the theories on how intermittent fasting helps?
Yes. Yeah, great point you bring up. Yep. So that's one of the things under the recommendations as far as lifestyle goes, would be perhaps intermittent fasting from a window of like 12 to 15 hours. Why? Because your body spends so much energy trying to metabolize and break down the food. So if we eat in a specific window, and all that other time, our mitochondria and/or our weakened mitochondria have the ability to use it to get rid of the junk in our body, we're only helping ourselves. So that is the theory behind intermittent fasting. And that helps many, many individuals. Is it for everybody? No, but we can tell by looking at your blueprint, so to speak, is this going to be beneficial for you?
Yeah, for sure. No, and I think that, I imagine it's really rewarding to be able to suggest lifestyle interventions, because then that allows the patient some ownership and some agency over, changing lifestyle in order to improve their health, but in a targeted manner, right? So
Exactly. And then that really, saying agency is the perfect word, because it brings them into this with responsibility of, here's what we need to do. And then for a lifetime, this is really going to benefit you doing these aspects of it. So it really makes someone, I think, become more mindful of what's happening in our body 24 hours a day, and then how we can help what's going on in our body become optimal.
Yeah, right. Yeah, for sure. And I mean, I think that, as I mentioned for viewers and listeners in the intro, what we talk about here isn't intended as medical advice specifically. It's more just for educational purposes. But I'm curious that, in addition to what we've already talked about here, things like the gratitude journaling and maybe intermittent fasting, if that is a part of a personalized plan that's developed with a qualified health professional and not just based on what we're talking about here. Right. Can you share some other general kinds of strategies that clients and patients often benefit from in terms of lifestyle influences to alter epigenetics for the better?
Right. So one of the big things, and so basic, sleep, right? sleep is a necessity for life. It's not like, and we've gotten kind of into this place of, with grinders, it's like, no, I'm working hard. I never sleep. I sleep 3 hours. Well, that's really unhealthy and you are going to crash. Our bodies need to sleep. That's when we recharge. That's when we detox. Like talking about, it's normal for your body to go through the detoxification every day between 2 and 4 a.m. Your liver is doing the hardest amount of work it does all day, trying to detoxify for us. So sleep, there's a reason sleep deprivation is used in warfare, because eventually it'll kill you, right? So it's necessary to start seeing it as something that's necessary and respect it. One of the other things is be out in nature at some point every day. To me, that's a huge piece. I mean, when if there's a day that I don't get to be outside, boy, do I know it. My mental health is just not the same. I am like, the tiger in the cage, let me out. But I tell people every day to spend time in the classroom of silence. And for a lot of people, they're really uncomfortable doing that, being by themselves. But if all you can do is for a couple minutes, start there. Kind of like meditation. Well, I can't because I have these intrusive thoughts. Well, start with just a little piece. And when it doesn't work, start again and start again. As a baby, when you first learn to walk, if you fell down the first time, would your parents say, oh, they're never going to walk? Forget that. Let's not put in the time, right? So to build all these things, we have to have the resiliency to keep on getting through it. But that silence is so important, because that's really where we start to learn who we are instead of all the noise and chatter of the outside world. And really, that part doesn't matter. It's the truth to yourself, what you are and how you're interacting with the world.
Yeah, no, thanks for explaining it. I love that term, the classroom of silence. I think that really encapsulates it in a beautiful way.
Yeah. And just a little story in the classroom of silence. Have you ever heard of the hike, the Camino?
Yeah, I have the pilgrimage in Spain, right?
Right. So I did that trek, and it's you're in silence. You are in the classroom of silence. And it started as I was doing a radio show, a syndicated radio show. And I thought, oh my gosh, this will be everything I talk about. The physical aspects, that's 800 kilometers. The emotional aspect, I want to do it by myself. It's going to take over 30 days to do this. The intellectual, well, it starts in southern France, goes through the Pyrenees Mountains, and then you walk from the east to the west of Spain, a couple languages in there, brush up on that. And then spiritually, it had a 1,200-year rich spiritual history of all these people that have done it and what it brought about. And that classroom of silence was a game changer for me. And I did that to end my 49th and start my 50th birthday. It's almost 15 years. I'll be 65 in May. And that trip allowed me to learn how to create and check in with that silence and be there. And that is a tool that have served me since then. I thought I was going to broadcast my radio show from this great venue. That was the last thing that happened. It was personal in spending that much time alone and clearing out all the clutter that's in here, and what it matters is to you and whatever your purpose is here.
Yeah. No, that's so inspiring. I'm gonna look more into that. I have heard of it, and I would love to take the time and walk the Camino. I think that sounds amazing. And I think that the cool thing about silence is that, again, if it's sort of like gratitude, where we're talking about, it's so accessible, right? So I think with silence, it can be as simple as, instead of turning on Netflix, or maybe before turning on Netflix, just have 30 seconds of silence, or 5 minutes of silence. Or it doesn't have to be meditation, it doesn't have to be anything where it's an added stress, but just silence, and see how that goes, right?
Yeah. And then you become comfortable with that silence. That's the thing. We just live in this frenetic society where it's just doing what, right? And that silence can be so much more productive in 30 seconds, in a couple of minutes, than just doing frenetically.
Yeah. Well, there's something to be said for even just the utility of attending to silence, as a way of just focusing the attention. I was thinking this morning, as I was saying at the outset, before we started recording that it snowed here in Vancouver the past few days. So I was out this morning with my 7-year-old and we were shoveling the walks, and we kind of noticed how quiet, how sort of specifically quiet that it gets when you're out in snow, right? So that the snow, I don't know what it is, the snow absorbs the sound more or something like that, but it just was really a cool thing to just stop and notice that for a few seconds.
Absolutely. I mean, I'm smiling here because you're bringing me back to times in the snow. I grew up in it, and it was like a blanket. And that first snow it's beautiful, and it is just so still, so silent, and you just take that in. It's amazing.
Yeah.
It's amazing.
I'm interested to hear more about your book, The Mystery of Happiness, in terms of the exploration of the science behind happiness. Can you talk a little bit about your book?
Sure. So really, it's The Mystery of Happiness, a step-by-step journal of gratitude, talking about happiness and where all that comes from, the different parts of what we've touched on already with purpose and identity and all those different parts. But it's in acceptance of you and your life. Happiness is not going to come from someone else's life. It's not going to come from something outside of you. And that's what we're all looking for, to get the quick fix, give me this or give me that. That's not how it works. Someone else's life is not going to bring you joy, right? So it's in getting comfortable and retraining your brain into what's happened to me today, what is the meaning of that, and where does that gratitude come from, and then reprogramming your brain to start thinking that way. And we're all looking for it coming from something other than within us, right? You know, it's so much of today is about comparison.
Yeah.
If you look at social media, it's all comparison, right? And comparison is a thief of joy. You are never going to find happiness if you are constantly comparing yourself to someone else. There's always going to be someone else who has more, who's funnier, better looking, has more money, whatever you think is what's going to bring you happiness. And that's what we're constantly doing. That's what, I mean, you even look at little kids, you know, a kid that looks at their phone before they even get up to start their day and go to school, they're already looking at what their buddies are doing. Most of the stories are not their reality of their life.
Yeah.
And they're comparing themselves to someone else, already starting their day as if I'm not enough.
Right. Yeah, for sure. No, it's for sure. I think it's really the media piece is a real key to it as well. It's almost like before when we were talking about personalized medicine and how perhaps a better understanding of one's own genome and how epigenetics can improve health and wellness. By learning that at a young age, you may be, getting access to your own user's manual. But what seems to have happened with media, whether it's, sitcoms in the 80s, I can remember watching sitcoms and thinking, well, their family looks like that and their house looks like that. So that's what I'm supposed to, get one day, right? You define yourself based on comparison with what you get in media, whether it's 80s sitcoms or Instagram, right?
Right.
So having a more authentic and realistic appraisal of what your personal user manual is by, whether it's the technology of the epigenetics and the genomic analysis and or the lifestyle interventions like the gratitude practice, it's probably a combination of all those things that's the most productive and the most likely to allow someone to thrive in that sense.
Exactly. And it is a combination of all of it, which was why I talk about those 4 pillars. You could be the most physically fit, eat the perfect diet, sleep 8-9 hours a night, run 5 hours a day, yet be the most unhappy person. You're not healthy, right? So it's all of it. And the conversations about the other parts of it, I really hope start to be more often with society, because I think that's the pieces that we're missing.
Yeah, no, I think that's really cool. So, I mean, it strikes me as a way of almost summarizing it is that, because of, I think I can't remember it's the person, but the quote about gratitude, it's not joy that makes us grateful, but it's gratitude that makes us joyful on the one side of the coin. And on the other side of the coin is this notion, as you've just explained, that comparison is the thief of joy, right? So recognizing and just keeping those 2 principles front and center, I think that would really, get people a lot of the ways towards utilizing both of those concepts if they
Right.
can be intentional about it in order to try to counteract the peer pressure and, like as you say, all of these kinds of contemporary influences that are sort of sinks for our attention that really grab us and hold us and make us feel as though we need to be a certain way, or we need to
Right.
achieve a certain thing in order to have a sense of self-worth, right?
Yep, yep. And then so if we take that physiological piece and some of the neuropsych genes, clinical correlation is dysphoria, meaning a lack of joy. So if we identify that and someone says, wow, that makes a lot of sense, I could say, hey, did you see that rainbow? That was incredible. And that is enough to make my day. Someone else is like, ugh, what's the big deal? Like, why is that so special? But knowing that's your starting point and saying, okay, what are we going to do? What exercises are we going to go through every day to strengthen that while we're working on the physiological aspect of it, and to understand that is your starting point. So it's not you trying to be Eeyore every day, but we're working on all aspects of it. That's pretty cool.
Yeah, absolutely. Yeah, no, it is. I think it's really helpful to, because I think probably well, I mean, I know from my work that, often it's really overwhelming for people to be. I mean, it takes a lot of courage to begin to come to see someone for help with addiction and mental health issues in the first place. So I would just say at the outset that, for people watching and listening, if this is something that you are struggling with, I would really encourage you to take that first step. And it does take a lot of courage. And so I would, I'm sure we would both encourage people to do that, to talk to someone that they trust, or to see their physician or counselor, or anyone really, to make that first step in trying to get help. But for people who have done that, just to know that that was a very courageous thing. And that, with these kinds of approaches, and it's, there's always reason to be hopeful in terms of trying to, find the combination of treatments and approaches to change lifestyle that might just end up being the key that fits into the lock that you've been looking for.
Exactly. And I do talk about courage in my book because it is so important. I think it's the primary element of all of the virtues, because without courage, we're not going to take those other steps. We're going to stay in our paralysis. And it does take courage for someone to reach out, to go to their physician, to go to their therapist, whatever it is they need. It takes courage to say, I'm going to take the step.
Mm-hmm. Definitely. Yeah. I'm curious then if we can maybe go back. We talked a bit at the beginning about spirituality, and I'm curious to know what your thoughts are around how you see spirituality playing a role in, for instance, addiction recovery and mental health in general.
Sure. So you look at like the premises of AA as far as spirituality goes. The first principle is that there's a being higher than yourself. So a lot of what holds people within their addiction is, I'm it, and all the stories they wrap around themselves to be the it, and the lies and the manipulation, because they want to keep this story in place. When you give that up, that's like a huge burden that's now lifted, saying, I'm a speck in all of this, right? And something greater than ourselves. That's, to me, that's such a large component of culture today, regardless of where you live on the globe. Culture today is that we're all it. We are all so egocentric that the idea of being one piece of something bigger than yourself allows you to take on all these different meanings and aspects of your life. When you think you're it, you've got to stay in that, because I'm it. Everybody's looking at me and I'm it, right? There's so much more to explore when you say I'm a piece of all of it. And it's interesting, Doc, I speak all over the world, literally. And I was in Australia, came home middle of December. So 6 weeks ago, maybe 5 weeks ago. No, 20th. So that's what people wanted to talk about at the end of it. I'd give talks and they're like, so let's talk more about spirituality. And for a while in cultures globally, it was, don't talk about this subject, don't talk about that subject. And the most concerning for by far the majority of people was a loss of spirituality. And I'm not saying a religion, a particular thought process, but the loss of spirituality and then what that is going to do to the generations to follow.
Mm.
And I would agree with that. We've got so many people who are lost. Their belief system really isn't anything because they're not sure what is the path that I'm even following, because I followed this guy yesterday and then I unfollowed him and then I followed her and I unfollowed her. The following is something totally different in their mind.
Mm. Yeah. It's super interesting. Yeah. One of the people that I have been reading and listening to is John Vervaeke, who talks about the meaning crisis, right? And yeah, really, it's amazing because it's not, in a way, it's not surprising, although it's helpful to conceptualize it as that, as you say, if the self is kind of elevated and there's almost a double-edged sword aspect to that, because there's obviously a lot of research that shows that a preoccupation with the self is in many ways equivalent to negative emotional experience. I mean, you're
Right.
automatically self-conscious. And so the more you're sort of focusing on and preoccupied with yourself, which is kind of what society just organically kind of
Yeah.
encourages people to do, right? As you say, with the comparison and the social media, there's, all this inherent focusing in on the self. But once you, another kind of, I think it's a helpful kind of thing for people to think about is to break down. Often recommend this for people who are in crisis. Like I look after a lot of people who are recovering from strokes, and even just yesterday I was, encouraging someone to, rather than worry too much about what may come in the future or thinking too much about what happened in the past, neither of which we can control to a large degree,
Right.
focusing on today,
Right.
aim high, and just try to have that, positive outlook as much as possible. But it's in the aiming high, it's in the reverence for something outside of ourselves, and as you say, it doesn't have to be religious per se, but it's just to be able to expand the attentional sphere outside of oneself
Right.
and sort of build that sense of healthy spirituality.
Right. Exactly. Very well said.
Can you think of any or recommend anything, that people could do that are interested in kind of exploring spirituality or perhaps, because that's the thing, right? I mean, I think a lot of people, if they have a religion, wonderful, or if they have a spiritual kind of practice, that helps. But I mean, I guess I'll just sort of thinking off the top of my head, it could be something as straightforward as the mindfulness and the silence that we were talking about,
Right.
and perhaps the gratitude. All of those things are spiritual practices in and of themselves, right?
Absolutely. Absolutely. I was going to say that the silence and also purpose,
Hmm.
That your purpose isn't just wake up and, go make X amount of dollars and that's going to make me happy to buy these things or whatever the case may be. We all need that to function. But when it becomes your only measure, I'd say, of what your life is about, I find the most unhappy people have no purpose.
Yeah.
And when start to talk to them about what's your personal, I don't know, that's the problem. I'm like, okay, so let's start backwards. Let's talk about what brings you joy.
Yeah.
Oh, I'm not sure about that either. Like, these are big things to spend some time and think about, because if you put yourself in a situation that brings you joy and you're working through that, you're going to find where your purpose is.
Hmm.
We all have to have purpose. Without purpose, we're done. We are going to find ourselves in every place that is going to bring up the worst in humanity that we can align ourselves with. So that's a really, really important piece.
Mm-hmm. Yeah. How about artistic pursuits? And there's this cool book called The Artist's Way.
Oh
Can't
yeah,
remember
great
the
book.
author's name, right? But
Carolyn
yeah,
Moss. Yeah, great book. Artistic, so good. Like the creative aspects, that would be under your intellectual health. Imagination, creativity. This is what makes us genuinely human, right?
mm-hmm.
So just think about that aspect of that gift that you have. Doesn't mean you have to be Picasso, right?
Mm-hmm.
But you have a gift that others don't. Other animals don't have creativity or imagination, right? So take that and run with it. what are you going to do with that today? And just make it a little thing, like open up your mind
Hmm.
to all of these possibilities. Absolutely. And even so many aspects of, like, when you talk about brain health, what's good, things like learning to play an instrument. If you always fantasize about it, or as a kid you played whatever instrument and then you gave it up, like, go back to those things, right? You're going to use both sides of your brain. It's going to be really healthy for you from a physical health aspect and then an emotional health aspect. But, like, this is all available. This is something that you can do today. Doesn't mean you have to be great at any of these things, but
Hmm.
pursue them. Put yourself out there. Allow yourself to fail at something, right? Really start to look at this thing of life like it's a game, and go play the game instead of being a bystander on the game. I mean, to me, our life is a gift.
Mm.
And so often people don't see it as the gift until it's just about over, or they're
Mhm.
realizing there's not a whole lot of time left. And then it's like, whoa, what did I really do at that time that I had? Was it caught up in all the nonsense of what everybody else is doing? Or was it really exploring what my purpose is here on life? I mean, one of my favorite quotes is Mark Twain, who says, the two most important days of your life are the day you're born and the day you know why. And when you
Mm.
know why you're here, people can recognize you because you're on fire.
Yeah. Yeah. I love that. I love that quote. That's
Yeah.
great.
Yeah.
Yeah. And I think that's super important to emphasize for people watching and listening, that the idea of play or doing something for enjoyment is so valuable, because again, we kind of have a watered, most of the time people have a bit of a watered down version of that, whether it's defaulting to, as I said before, watching Netflix, or doom scrolling. It's a watered down version of enjoyment, right? So just whether it's, so say if it's an artistic pursuit and you think, well, I'm not an artist, I'm never going to be an artist, but the point isn't, again, to get into a comparison kind of game with thinking about what a real artist in quotation is supposed to do or be like. But like what Rick Rubin says, I mean, art, the way that he encourages people to do art is to do it as if you're writing in a diary and you don't expect that anyone's ever going to be reading it.
There
So
you go.
it's for you and for your own enjoyment. And that's how it starts, right?
Yeah, absolutely. And exploring all those different aspects of your life really make you see it as, this is something special.
Hmm. Yeah, totally. I was just curious, as we sort of work, as we kind of wrap up here, what would be a couple of things that you think about would be, um, the frontier, or where do you see the future of addiction treatment and mental health heading in the next few years or decade or so?
Sure, sure. Great question. I really see it as looking at the biomarkers and the individual personalized medicine, and knowing what someone's starting point is, and having that foundationally being something that's worked on while you're doing all the other aspects. Unless we do that, we're going to be dropping the ball. We're just going to be still, it's like 1950. Nothing has changed in the way treatment is today versus then. We need to incorporate what we've learned with technology and use technology for good in this area. Every other aspect of healthcare has embraced technology. In
Mhm.
addictions, it's kind of still this is the way we're going to do it, pound it out, and if the results were there, we wouldn't even be having this conversation, because there would be no reason to say, what else can we do? What can we do better? What have we learned?
Right, right. Yeah, I love that. It's bringing together those seemingly disparate but really integral factors. So all the way from the spiritual side,
Yep,
the psychological, the spiritual side, right down to the nitty gritty of the genetics and the biochemical piece. And bringing it all together. I think it's super interesting.
absolutely. And I think our future is bright if we employ it.
Yeah, for sure. That's great. Maybe you can help viewers and listeners understand how people can learn more about your work and connect with Wired for Addiction and Wired Biohealth.
Sure. So first off, we could go to the website, Wired for Addiction, spelled out FOR, wiredforaddiction.com, peruse through there. You can set up a 15-minute complimentary consultation. What's going on? What's the problem? What are we talking about here? What's been done so far? What's worked? What hasn't worked? And we'll point you in the direction, if it's starting with lab work, if it's some other resources we could share with you. If addiction isn't where you are, the Wired Biohealth. So that website, wiredbiohealth.com, go there. Same thing, complimentary consultation. Tell us what's going on with your health, how we can help, or our phone number, 888-841-7099. So any of those ways. We have a lot of podcasts on our Wired Biohealth that people can listen to. I've had people say to me, I listen to every day because I need that reinforcement. Which is a great tool, positive reinforcement. And as you talked about the mystery of happiness, incorporate that into your day. It's a minute, it's 2 minutes, it's nothing. It's more of the habitual, making yourself think a different way. And then talking about the 4 pillars is the Dr. Higgins Guide to Health and Wellness. And I go over those 4 pillars in really simplistic language, but gives you an understanding of like, wow, there's a lot of different pieces here. And a lot of them you can start immediately.
That's great. And we'll put links in the show notes for viewers and listeners. They can check all that out. I'm tempted to actually come down and get a consultation myself. And I'll tell my family doctor up here that, well, if I can't get what I need in the Canadian system, then I'll head down to Florida and get away from the snow. And my son's been bugging us to go to Disney World as well. So maybe we'll roll it all into a trip down there sometime soon.
There you go. Instead of shoveling the snow with your son this morning, say, you know what we're going to do? We're going to Disney World. Let's go.
That's right. Fantastic. Okay. Well, Dr. Higgins, thank you so much once again for joining me. And our viewers and listeners are, I'm sure, very appreciative of your wisdom and all of what you have to offer. And I really would encourage people to check out, your program and get in touch with you and find out how you and your team can help them.
Thank you so much, Dr. Passmore. And thank you for the work that you do with your podcast. Having these kind of conversations and taking these subjects that aren't that often talked about and really making them part of the mainstream conversation. I thank you for your work.
Great. Oh, yeah. That's great. It's really fun. And it's really fun to have these conversations and share ideas and do what we can do to help people out. So thanks again.
Thank you.
Okay. Take care. Bye-bye.
You too. Bye-bye.
Thanks a lot. Bye. Thanks again, everyone, for watching and listening to the Neurostimulation Podcast. I'd really encourage you to like and subscribe. And if you think that this episode might resonate with somebody that you know, please share it with them. It's the best way to get this podcast out there so that more people can benefit from the content. Also, if you have any comments or questions, please indicate those in the comment section below. We have links to the relevant information from today's episode in the show notes, and I would really encourage you to check those out. Thanks again. As always, I want to mention that I really do sincerely appreciate your interest, your time, and your attention. So thank you again, and we'll see you next time on the Neurostimulation Podcast. Take care and stay curious.